Hi, I'm Gladys, a nursing student of UMAC. Today, I am going to present a concept map of peptic ulcer disease. Peptic ulcer disease, or PUD, is the loss of mucosa of the GI tract, caused by the decreased resistance of mucosa to acid pepsin injury. The risk factors are H. pylori, ulcerogenic drugs, cigarette smoking, alcoholism and caffeine, stress, and NSAIDs. In peptic ulcer disease, the patient will complain epigastric pain. The common sites for PUD is the first part of the duodenum and lesser curvature of the stomach. PUD in lesser curvature of the stomach is called gastric ulcer. The pain in gastric ulcer is aggravated by eating because acid secretion increases at mealtime, which is relieved by vomiting, for obvious reason that acid is expelled out by vomiting, which then leads to weight loss. There is no pain at hours of sleep because hydrochloride production decreases at hours of sleep. Gastric ulcer is more common in older people, mostly in females with family history. PUD in the first part of the duodenum is called duodenal ulcer. Pain in the duodenal ulcer occurs 2 hours after eating. Pain is relieved by food because the pyloric sphincter at the junction of stomach and duodenum closes upon eating to concentrate food in the stomach, which then causes weight gain. There is pain when sleeping because gastric emptying continues when sleeping. Duodenal ulcers are more common in middle-aged people, mostly in males with no significant family history. To diagnose PUD, we need a test for H. pylori, which includes blood test, breath test, and stool exam, also endoscopy and X-ray. Epigastric pain in peptic ulcer disease can be managed by diet, such as avoidance of food that increases acidity, small frequent meals, and bland diet, which is low in chemical and mechanical irritants. Can also be managed by medications like H2 blockers to inhibit gastric secretion and antacids to neutralize acids. Proton pump inhibitors to block the final step of gastric acid production. Sucralfate provides local protective coat lining of the stomach, and antibiotics for H. pylori. For surgical management of peptic ulcer disease, we have subtotal gastrectomy, which includes Billroth 1 and Billroth 2. Billroth 1 is gastroduodenostomy and Billroth 2 is gastrojejunostomy. Total gastrectomy, which is the removal of the entire stomach. Atherectomy, removal of the lower portion of stomach. Pyroloplasty, the incision is made into the pylorus to enlarge the outlet and relax the muscle to enhance emptying. Vagotomy, interruption of vagus nerve to decrease gastric secretion.